All right. So glad to have all of you here this evening. We are really excited to talk to you about how to keep your heart healthy. Like we were talking about with some of you who hopped on earlier, a lot of people want to know how they can avoid having to take medications that they feel like they get pushed towards or moved towards, sometimes in their 40s and 50s. And we're going to talk about how you can avoid that. Just as by way of introduction, my name is Dr. Joel Dayton. I have been practicing as a chiropractor here in the Orlando area for 9.5 years, and this is my wife, Crystal, also a chiropractor. Um, what we're going to start out with is if you've been on with us this year, every month we've talked about a different one of these topics within this pyramid. And now we are at the informed self-care part. And this is the part where we get to talk a lot about healthcare, which is really, really fun. Tonight we are going to be talking about how you can take matters into your own hand, which makes me super excited because we like to be able to teach people how they can be proactive and understand their own health and be able to take care of it themselves. So we're going to talk about some of that self-care, starting with a couple stats we're going to talk about. This is the sad part of our conversation, but we have to do it because we have to set up what's going on with our with our health. But if we look about what is going on with our healthcare, as far as our cardiovascular health in the United States, um, heart disease has been the leading cause of death in our country since 1921. Before that, people would die of the flu and they die of other communicable diseases, but they didn't die of heart disease. But that all changed in 1921, and it has been ever since. In fact, 1 in 3 people in the United States die of a cardiovascular disease every year. That's what the stat is. 1 in 3 deaths are from cardiovascular disease. What that equates to is about 1 million people. In fact, in 2023, just shy of 1 million people died from heart disease. So, let's talk about the start of medication use and where we've come from and where we are now. So if you look back in 1988, we're going back, just a couple of years, but 1988, more than 35 years. Um, the amount of blood pressure medication, you compare it to where we're at now or at 2019, that's the latest figure I could get. And obviously, we've started taking a whole lot more. If we can compare statins, so in 1987 was when statins were first introduced to the market in the United States. So in 1988 was the first time that people started using them. And obviously, they've exploded since then. You can see. Um, Now, where are we at heart disease? Well, in 1988, we were just hovering around 25%. Now we're at almost 50%. And I have all these stats on the next page, and you can look at them a little bit more closely. It's kind of funny. You would expect if heart disease is growing, uh, then why is it not getting smaller when we started taking all these medications? Clearly, the medications aren't healing us. They're just helping us maintain unhealthy hearts, which is sad, right? So if you look at these here, the stats that are broken down, I have it in a graph form there, but these are the actual stats. 25% in 1988, 48.6% now have heart disease. 0.1% use statins, 35% now, and 13.7 to 23.8%. So we really need to talk about our heart health and how we can actually help heal ourselves rather than just maintain unhealthy hearts. So let's talk a little bit more about statins. This is kind of interesting, but in the last few years, there's been a new hypothesis that decreasing your LDL cholesterol is not actually what's actually helping with statins. Instead, what's actually helping with statins is the fact that it has anti-inflammatory effects. And this is true. Um, that statins will decrease inflammation in your blood vessels. Um, so this whole obsession with focusing on LDL cholesterol, unfortunately, is not really helping the matter. It's not helping us actually be healthy, but it's the anti-inflammatory nature that actually has any type of effect from the statin that helps us. So why do we want to avoid statins? Well, they're going to create things like peripheral neuropathy. Unfortunately, this can happen where you get, for those of you who don't know, peripheral neuropathy is a lack of feeling in your fingers and toes. That's usually where it starts, and it can move even further into the foot and hand. You can get pretty severe muscle pain related to statin use. And there are a whole laundry list of side effects. These are just some common ones, but there are a lot of side effects that can be associated with statin use, constant statin use. Another thing that is interesting about statins or statin use, we have so many people who are so worried about not having hormone imbalances and having hormone issues. Well, interestingly, your cholesterol is your base of all your sex hormones. So if we're so obsessed with decreasing our cholesterol, we're not going to have the cholesterol to actually build our sex hormones. And that's a really big issue. So when people are, I don't have enough testosterone, I don't have, yeah, we also don't want to be decreasing your cholesterol because that is going to result in you not being able to create what you need to in hormone. Yeah. So um, this is our fun little interactive part. So taking statins daily will increase your lifespan by, I want you all to unmute and you get to guess how long it will increase your lifespan. This would be for all cause mortality. So go ahead and unmute yourself, and I want you to shout out a guess with what you think.
I had guessed a year
You guess a year.
originally.
I guess it won't.
It won't.
If
Okay.
you die before.
Okay.
That was another guess I had too.
So Vivian says it doesn't increase
Great.
it at all. Anyone else?
No, not at all.
Anyone else want to guess on how long it?
Yeah, I'll go with not at all as well.
Not at all.
Mhm.
Okay. Any other guesses?
I'm gonna say not at all also.
Okay. All right. All right. All you health nuts out there, you good. Good job, guys. So here's the answer. 10 days. 10
Oh,
days. That's the official, is that it increases your lifespan by 10 days, which is incredible. And in fact, so you'll see, if you see these, I have citations at the bottom. These are from research articles, so you can look those up. But this one on the right was that one that told you about it only increasing 10 days, which is insane that it's pushed so hard, and it only increases all-cause mortality, whatever you have, by 10 days. I was like, that is crazy. So
Trade-off.
that's probably a manipulation of facts.
it might be. Well, actually,
Just to say it helps.
so I said it was like it's interesting you should say that, because there are actually a couple studies that say it's 3 to 4 days, and so it's like,
Oh.
yeah, I know. So 10 days might be too much, but
The trade-off is we have patients who they'll be coming and seeing us for their pain, and at a certain point we're like, okay, you should be making this progress. Let's review your meds. Oh, you have
Yeah.
statins in the mix. And then we
Mhm.
work them to co-manage on getting that out. And then, yeah, their pain starts to
Yeah,
reduce. You have that too, Vivian.
exactly. I got that. Mhm.
Yep.
Yes.
So, I mean,
I lost a patient though.
oh,
I do a lot of pain management, but no, I'm
okay.
happy. Trust me, I'm happy.
Yeah. So,
And this, let me ask you a question. This is after taking this medicine for how long?
oh, this would
You
be
have 10 days.
this would be taking it daily,
For
and it's
For how long?
it would be for years if you take it for
For
years.
years.
Yeah, for years, and it increases 10 days. Yeah, this is just
Yeah, that's what I thought.
this is taking it daily for years would increase your lifespan 10 days. So yeah,
Mm.
it's unfortunate that now, I mean, if you really have a zeal for life, a vibrancy, and you really want those 10 days, I guess maybe it's worth it. But I'm going to give you some better ideas of what you can do
Yes.
instead of that.
Longevity.
More longevity and more like
Health and
vibrance and
yeah.
excitement in life. And these are the things. And like these aren't, a lot of these aren't rocket science. Some of them might be newer ideas or give you some information, but some of these are just very simple. But I'm going to talk about these 4 things as a way to help support your heart health. So exercise is your first. How much does exercise help? Okay, so because this is something everyone knows that they should exercise, but how much do we actually implement and how much does it help? This is really cool. If you exercise 3 days a week at medium to high intensity of training or exercise, you can decrease your risk of a heart attack by 30 to 40%. That is huge. And that's why I started out with this one. It is a huge, huge factor that just by exercising, keeping your heart healthy and metabolizing properly, because that's what happens when your heart has to work out. It needs to learn how to metabolize and break things down properly and utilize them, right? So when you teach your body how to do that, you're going to have longevity. You decrease your chances, like I said, by 30 to 40%. Super significant. Very simple. And it really doesn't matter which exercise you choose. You can do lots of different ones. If you want to do a brisk walk, if you want to exercise on your standardized bike, if you want to do cardiovascular, if you want to do jumping jacks, calisthenics, whatever it is, just do it and do it 3 days a week at least. And if you want to do less high intensity, like a medium intensity, you could do it 5 days a week and you're going to get the same outcome. So that's our first step is exercise. Very, very simple. Our next one. So we touched on this just a bit, but when you eat too much sugar, it damages the inside of your blood vessels. It causes inflammation. And let me explain what happens there. So when sugar is constantly being pushed through your blood vessels, it's going to rub and cut the inside of your blood vessel. And when that happens, your body responds by sending cholesterol to go patch that up. So when people get so obsessed about we have to decrease our cholesterol, actually the cholesterol is actually helping to create a scab from a bigger issue that you had, which was too much sugar in your diet. So if we can decrease the amount of sugar that's circulating, we're actually not going to use the cholesterol for patching up our arteries, right? Creating that scar tissue. That's what this when doctors talk about plaquing, that's what this plaquing is it's actually laying down cholesterol on the inside of your artery because that artery has been damaged. Okay, so ideally we don't have that sugar circulating through your system, so that doesn't happen. And then ideally also what you should know is cholesterol needs to be used for the things that we talked about, like hormones, but it's also used as a great source of energy, particularly for your heart. So your heart would actually prefer to use cholesterol as opposed to sugars, because cholesterol is it's a longer lasting source of energy, and it's more dependable because sugar will break down very quickly. Cholesterols are like a long string of stored sugars, but it's a long string and it's more predictable for the body to use it than it is to use just a simple sugar. So avoid sugars because that will avoid you having damage inside the blood vessels. Okay. Next, avoid your ultra processed foods and eat real foods. Again, when you do this, you're going to inhibit the amount of inflammation that you create in your body. And with lower inflammation, you're going to have lower chances of having damage to the interior of your blood vessels. Okay. Also, Very simple way, and again, I don't think this is new to probably any of you that are on the call, but fruit juices, sodas, and alcohol. We want to try and avoid these. These are all considered simple sugars, right? They're simple carbohydrates. Your body metabolizes these extremely quickly, and as a result, meaning that it absorbs them very quickly and it can utilize them quickly, but unfortunately, it's also going to go into the bloodstream and cause damage inside those vessels. So these are things that we want to avoid. Again, these are just simple eating rules. I know a lot of you know this, but it has a very, very significant impact on your health, on your heart health. Okay, stress reduction. So one of the highest causes of fatal heart attacks, right, is prolonged stress. So this can be a job, this can be family emotions, this can be whatever. If we have a prolonged source of stress, this is going to lead to a higher blood pressure, which can lead to a myocardial infarction or other cardiovascular event, right? Very simple, and there's actually good research to back this up, but having regular meditation or prayer practice, okay? That is going to help regulate your stress. In fact, there's some really interesting research that I was looking at for, I believe it was called Ray Yoga practice. It's a type of meditation, but it's like a spiritual meditation where they showed that they could reverse cholesterol and high blood pressure by practicing this daily. It was for 2 months that they had this regular practice of it, and it decreased blood pressure by, it was about 10 to 15 points. It's very significant. So it was really, really cool. So if you like to meditate, if you like to pray, make sure that is an important part of your life. If that's in the I would suggest doing it in the morning and the evening before you go, obviously before you start your day. If you are stressed when you wake up, take a little moment to pray, to center yourself, and to be very, very grounded. Also, before you go to bed, you don't want to go to bed with a racing mind and have that stress response creeping into your bedtime hours. So make sure you take time to either pray or meditate in the evening. Another one is spend quality time with those you love. Now, I just said that relationships can cause stress, so make sure you really love them if you want to spend time with them, and because they could cause you stress. In all seriousness, there's some very good data that shows that by spending time with people that you love, it decreases your chance of having a heart attack or stroke. It decreases your chances of having a heart attack by, I believe it's 25%, and stroke by 32%. So it's very significant. We need to interact with people. We need to connect with people. We need to love and share love with people. And by doing that, you're going to decrease your stress. So make sure if you don't have those friendships, family relationships, go out and start being involved in a club or find something that you're passionate about and find some people to do it with, because that will help you decrease your stress. Okay? All right. So what if you need more than what we've just talked about? Well, let's talk a little bit about that. And to do this, I have to start out by talking. I'm going to go a little bit more in depth about what statins do. We touched on this earlier, okay? This is not the place where I want you to end. Just say like, oh, okay, well, if I need more, I'm just going to take statins. This is usually because when you go to the doctor's office, they'll say, hey, you need to change lifestyle habits. And the lifestyle habits that they don't go into depth, but they just say, you need to change your lifestyle. You need to eat better. What we've just gone over is more in depth about what those lifestyle habits look like. But what if you do need more? They're going to say, well, we're going to put you on a stat, or we're going to put you on blood pressure medication, right? So here are some, I wanted to show you a couple of articles. These are meta-analyses and systematic reviews of statins and what they are doing to decrease inflammation. Now, you'll notice these are not talking about LDL cholesterol, which is what they always tout. Oh, we're decreasing LDL cholesterol. There, it actually doesn't make a difference as they say it does. So the things that statins probably what they're actually really decreasing is your C-reactive protein. So this is showing C-reactive protein is a marker for inflammation throughout the body. And this was a series of, I believe it was 30 plus studies that showed that statins have a very significant effect on C-reactive protein, decreasing C-reactive protein, right? Also, interleukin 6, this is a measure of inflammation again. It has a very significant effect on decreasing interleukin 6. So, why do I bring those up? Well, because omega oils, specifically omega 3, have the same effect. They affect the same factors. In fact, if you look at this was from a meta-analysis that I pulled from PubMed. They said that their findings demonstrated that this is omega 3s and PUFA. Supplementation significantly reduced serum C-reactive protein, which is what we just said, CRP, tumor necrosis factor, which that isn't even that doesn't decrease by statins, but this is another marker of inflammation, and interleukin 6. So, in fact, in another study I looked at, omega oils, omega 3s specifically, can decrease your CRP levels by up to 23%. So very, very significant. And this article, the one that I'm citing there with the 23%, that was actually in people who smoked. It actually was able to decrease their inflammation, their inflammatory markers by 23. I was like, that's really significant. That's really cool. So, very potent, very strong, and very effective at helping to decrease your inflammatory markers, which in effect is then going to help your heart. It's going to decrease the inflammation in your heart, and it's going to help support your heart. Okay. This is one that we love. This is one that we've used for 6 years, 7 years. I don't know. Yeah, but well, not specifically the Omega Plus. They just came out with the Omega Plus, but we had used Z Omega before from doTERRA. This new, it's been out for about a year. Their E Omega Plus, it comes from fish off the coast of Norway. Let me tell you why that's actually significant. These omega oils, there's some really interesting research that was done that compared omega oils. I believe it was from 1994, and then they tested them in 2004. And they looked at farm fish, farm-raised fish, and they looked at the EPA and DHA levels, which are omega oils, right? They looked at those levels, and they compared the farm fish in 94, and then they compared them in 2004, and the level of DHA and EPA was cut in half, the amount that it had started out in 1994. So basically, you have to, if you're going to do farm-raised fish, which usually are not fed normal food, they're usually fed meal and corn and things like that, unfortunately. Those fish have significantly less of omega 3s. So we love this because it's all wild caught. Yeah, very, very healthy, very good for you. And it's going to have those great protective effects for your blood vessels, taking down inflammation. Cool. Let's talk a little bit about, we talked about blood pressure earlier, blood pressure medications. If you want to decrease your blood pressure naturally, there are several things that you can take to help decrease your blood pressure. This first one, Aronia melanocarpa, I can't say it very well. I'm never good at reading really well. She laughs because it's true. Um, but I forgot what the word chokeberry. That's what it's called. Chokeberry. Yeah, it sounds Aronia melanocarpa. It sounds so much nicer than chokeberry, but this is a chokeberry. And this has really strong effect. In fact, I have a I didn't put the citation. I have it in my notes here. But it can actually after taking it for 8 weeks, it showed that it had I believe, let's see, it was a 12-point reduction. No, it was more than that. It was like 15-point reduction in your uh, in your blood pressure. Yeah. Um, so very, very significant. Very, very significant. That was the systolic. And then the diastolic, it had a 10-point drop. So very, very significant. Here are other things that if you pile these on top, if you have blood pressure problems, they will have enhanced effect. So you've got CoQ10. There's good research showing that probiotics, having a broad spectrum probiotic, can decrease inflammatory markers and decrease your blood pressure, right? Turmeric, grapeseed extract, ginger root, and we've already talked about it, omega-3s. These can all help naturally lower your blood pressure. What I love about this is this. If I don't know, some of you probably use this, but the VMG, which is doTERRA's greens.
Vitamins, minerals, greens.
Yep, correct. It's a vitamins, minerals, and greens complex. It comes in this little sachet. It has all of those things that we just listed in here, with the exception of omega-3s. The omega-3s are in the omegas that I just showed you, right? But it has all of those plus more. I don't have like, there are actually more that I didn't even list here, but these were like the really heavy hitters that I wanted to highlight. But all of those, if you got all of those separately, it's going to be very expensive. That's the truth, because if you buy each of these individually, the nice thing is that they're all in here, and it's in a green form, which is really nice. It's all in their whole food form, which is really,
tastes great.
It does taste great.
Compared to a lot of the greens are really chalky because the essential oils are present. And they also use the liposomal technology. It's smoother.
Yeah.
And it has more of the mango, pineapple flavor that they include.
So
it tastes good.
Really nice flavor, and it has all of those, which is awesome. But these are, if you look at all the foods here, those are all foods that are in the BMG, in addition to the things that we just talked about, the herbs that we just talked about. So this is what I would recommend if you want to keep yourself in tip-top shape for your heart. VMG, the E omega, and then this P Restore. This is our daily. This is what we do for our daily vitamin regimen. We do the PB Restore, which is a probiotic. It's a broad spectrum. It is the best one that I've seen on the market.
Because it's not just a pro, it's a prebiotic, postbiotic, and it has bacteriophages.
True.
So not only are we adding all the good, but we can kill off all the bad bacteria that are present there as well.
Yep. So these are our go-tos, and these are the ones that we love, we take every day, and we haven't had a heart attack yet, so no.
You're too young.
So that is what we have for you tonight. I'm going to stop the share now.